You want healthy, glowing skin, but with all the products, trends, and conflicting advice, it's hard to know what actually works. I understand. I am Dr. Tina Meder, a former cardiologist and specialist in the skincare development and cosmetic safety expert. I've spent years studying the science of skin. Welcome to Meder Beauty podcast, where we uncover what really matters, break down the science, and give you real expert-backed skincare advice. Whether you're looking to achieve radiant, healthy skin, curious about anti-aging, or want to understand what's really in your product, you are in the right place. Rooted in science and the truth about what your skin actually needs, we'll have in-depth conversations with leading dermatologists, medical experts, and skincare brand founders to bring you the latest innovations, evidence-based insights, and industry secrets that truly make a difference. We are so happy you are here. So let's go! Hello, and welcome to the Skin We Live In podcast. I am Dr. Tina Meder, and today I am in London, and very happy to present you Dr. Anna Kantser, the founder of Dr. Anna Aesthetics Clinic, one of the founding members of the Royal Society of Medicine's Aesthetic Medicine sections, and general practitioners with a special focus in dermatology and specialist in aesthetic medicine. And I dare say that Dr. Anna is one of the people and doctors who represent the new generation of aesthetic medicine practitioners. Thank you so much for joining me and to invite me to your beautiful London-based clinic.
It's really a pleasure for me. And I wanted to talk about injectables in aesthetic medicine.
Understandable.
Yes, we're living in the golden age of injectables, where we can restore volume, stimulate collagen, and improve the skin quality like never before. Many patients who spend thousands on Botox, skin boosters, fillers ask whether they really need skincare. Or is skincare just a marketing upsell? Today we will try to answer this question. And before answering this question, I wanted to ask you, Tina, why you are so passionate about skincare and what is the main focus of your cosmetic line?
Thank you so much for this question, because I understand that many people see me as an unusual doctor because I am not practicing aesthetic medicine like it is usual for aesthetic medicine, injectables and laser treatments.
Like
quick fixes and, let's say, high-tech treatments of aesthetic medicine. And I am specializing in the topical applications. So skincare and at some point a dermatological application. And it was my focus since the very beginning. And I started in the mid-90s. And my focus, first and foremost, it is the skin microbiome. Since the very beginning and start of the microbiome science and human microbiome project started in 2007. So I was absolutely fascinated by the whole idea, and also new opportunities of peptides.
Why, we hear a lot about microbiome. Why microbiome and skin?
Because actually skin and gut, they are two organs mostly researched and studied.
And probably mostly populated.
Yeah, as microbiome hosting surfaces. And I will not take a risk to say that they are most populated, because just recently, a few years ago, we've been thinking that the blood is sterile. Now we know it is not. We've been thinking that the brain is sterile or the womb is sterile. It is not sterile even during the pregnancy. So there will be a lot of discoveries upcoming in the next years.
So probably your cosmetic is more to support microbiome than to destroy it. And that's the beauty of the cosmetics, that respecting microbiome.
I think then we should change the whole paradigm of the skincare, because if we've been seeing skin as an isolated organ, now we understand that the skin is the human body, and any kind of biological object on our planet. We are ecosystems. So it's, I love to think about the microbiome as a two-way street because we have our microbiome. So we are planets for our microbiome. But in the same time, we are very small part of the microbiome of our planet Earth. Cannot separate us. We need microbiome. Microbiome needs us. And when we care about the skin, we should keep microbiome in mind because it is part of the skin. It is a living layer of the skin.
And many of my patients ask, do skincare really work? And whether molecules can penetrate deep in the skin?
That's another great question. And yes, skincare can really work, but that's a lot of skincare, which is not. It depends very much on the formulation, on the vision of the formulator, and there are many factors which define the penetrations of ingredients into the different skin fire. First, it is size matters. Everything which is smaller than 500 Dalton of molecular weight will penetrate into the skin easily. You cannot stop it.
So the molecule to create this little molecule is so important.
Retinol, 140. Glycolic acid, 128.
So they kind of hit on the top.
They're just going like a train into the deepest layer of the skin. Ionic acid is 6 million Dalton. So for all money on the planet Earth, it cannot penetrate.
Exactly.
It stays on the top. But also when we are speaking about ingredients which are with molecular weight slightly higher, like I would say up to probably 5,000 Daltons max, you can make them penetrate into the deeper layer going through stratum corneum using different types of enhancers. We have 600 of them.
Right, okay.
So you can use different formulations, and it's what defines a good cosmetic chemist.
That's my second question, because many creams seem to contain similar ingredients, but the price differ. And why expensive brands, let's say, why they're so expensive? Is it because of the technology of the cream creation?
Honestly, sometimes it's just marketing.
Right.
Especially, I'm sorry to say this now,
On the camera.
dressed out the cameras, but I think that many of the influencers created brand. It is marketing because, all this investment in the Google advertisement and Meta advertisement, it will take 90% of the cost of the product. And also officially, in the last year, the report of 2025 is still older, 52% of cost of the product. It is a cost of marketing. And L'Oreal, same. Professional brands, story can be different.
I think it's important to tell your honest opinion, and even if it's upsetting for someone, I think we're here to discuss really the science behind the products. Why then some people have great results and some people don't? Is it because they use some products in the right way and others don't? We have already discussed the quality of the different creams, that molecule matters. But what about the patients themselves?
There are many sides in this story because molecules matters, formula matters because you can use great molecules, but formula created by an experienced cosmetic chemist can stay on the top of the skin just because it is not created with penetrations in mind, and there is a whole layer of science about penetrations of ingredients into the skin. And quality of the skin matters. Paradoxically, when you have a client with a very dry, thin, irritated skin, you can have great results from the very first days because the skin is overpermeable. And if you need something to penetrate deeper, it's always there.
It's ready to take everything.
Exactly. You put on the skin, it just going into the deep of the skin. But when you restore the barrier, it's become more difficult.
Right.
So it is a paradox of the skincare. It can work amazingly in the first weeks, but when you restore the healthy skin, skincare can be less efficient.
Less noticeable. I find it with injectables. When people are coming with their good quality skin and we do some treatments, they see less result compared to those who never done any treatments because their skin is responding with so many results and they can see the actual difference.
I think that's also the factor of skin health itself and, hallmarks of aging. Now we are speaking about 12 hallmarks of aging, which is all interconnected to each other, from genomic instability to inflammation, microbiome balance, and so on. So 12 of them, they can be very prominent in someone else's skin. For example, if the person is aged, exposed to the stress, has some lifestyle habits which are not beneficial, smoking, some alcohol use, and some choice of the food and diet. It can affect. And you can have a very healthy person who probably at the same age sleeps well, is physically active, using good skincare, eating well, and not so much stressed. And once again, when the hallmarks of aging are not very active in the skin is regenerating better. And paradoxically, injectable materials can be resorbed faster.
Yes.
So it's really a two-edged sword.
Yes, that's true. I want to ask you, what is wrong with retinol?
You know me. Yes. People see me as retinol warrior. I'm not. I love retinol. Retinol is one of the most researched ingredients in the cosmetic science. It is a great ingredient. The problem with retinol, first, it is systemic absorption, which cannot be excluded because the molecule is very small. It's absolutely biologically identical to the human body. Vitamin A at the form. So our body can use it not for the skin only, because retinoic acid what makes our body to renew not only the skin, but our intestine and even our brain. So when you eat well, when you have the naturally high level of the vitamin A, and you start to use topical applications with retinol, good quality of retinol, it can bring the risk of the overdosage of vitamin A.
As we know, vitamin A can be a teratogenic component, and it's not allowed to use in pregnancy if you're using,
for obvious reasons,
strong retinols, topically even.
It's still a discussion about it because actually there are only 8 cases which have been formally recognized as retinol teratogenic, so embryo harm. But 8 cases, it is not 0. So me personally, I think that we should be careful. And also, when retinol journey started in topical application in the 80s, we've been very limited in the choice of ingredient. Now we have a lot of ingredients. We have 12 retinol-like category. So you can replace retinol to avoid it. And me personally, I think that retinol should stay in dermatology, should be used safely under the medical control. But speaking about the skincare, especially preventative skincare, we can go safe.
I have recently a patient who was chatting with a very famous beauty expert on the plane, and he asked her, tell me one thing which I can do and which will give the excellent results. She said, very strong retinol, the one that you get from the pharmacy, use it once a week, that's the best thing. And when I heard that, I thought, probably your skin will be shocked when you apply it on the face, and for a couple of months you'll be burned, and you can achieve the same amazing results using either very low concentration of retinol or using amazing molecules like enzymes. I think many of your cosmetic brands, the cosmetic products, they have so active components. Can you tell a bit more about the actually active components?
First of all, if someone asks me what is the best thing to use for my skin, I will ask about their skin.
Right.
Because it can be different target. Retinol can treat acne, pigmentation, it can be used as an anti-aging ingredients and so on. But if you go deeper into the skin needs, if it is someone who is really worried about the skin aging, I will go probably first for microbiome rebalancing, because that's a lot we can do. There are different prebiotics, probiotics, so we can regrow useful, and we can delegate big part of our work to this microflora, which is able to synthesize hyaluronic acid and to do a lot of things and to protect skin cells and so on. And another thing, I will probably consider peptides. Also, we have a lot of them and some remodeling peptides.
What is the magic about peptides? I think they're everywhere now but can you tell a bit more? Why peptides? What do they do? What is the magic?
Magic of peptides, and they can be used as a language. They are messengers. With peptides, we can gently speak with every cell in our body. And obviously, as a skincare expert, I'm speaking with the skin. But now peptides, it's kind of the new hope in the pharmacology. And look, GLP-1 drugs,
exactly.
peptides.
Weight loss drugs is peptides?
Absolutely. We learn how to speak with the brain center to ask it do not eat too much. We can use peptides, which is speaking only with overexpressed pigment cells, which are already harmed by the ultraviolet, asking them to go back on the normal way of the melanin production. And now we have about 1,000 of peptides. So we have this dictionary.
I think it's the future of medicine as well. There are many injectable peptides not yet approved. It's in the UK, yet I think it's developing extensively.
It's absolutely transformed medicine. We are on the edge of the real precision medicine when many of conditions can be treated much safer, much more efficient, without drastic side effects. Because peptides, what are peptides? Chains of amino acids, which used like letters, because you change the sequence of 3 letters in the word. It's a different word.
Different language, yes.
Same with peptides. And now we can speak with our body. And once the word is used, amino acids are absorbed and used to build muscles.
Yes,
in our body or vessels. So
everything genius is very easy. I want to ask you about pigmentation, because you mentioned peptides for pigmentation. I want to ask you, some of my patients, they apply religiously their SPF, but still they develop pigmentation. What do you think is the problem? I noticed, I think on your website, there are recommendations how to use skincare. And one of the recommendations was for SPF. And I want you to actually tell about this.
We still don't have SPF. I'm working on the formulation for 14 years. I'm still not there.
You haven't found the perfect one?
No, because there are a lot of really good quality SPF products in the world, and I don't see the point to add another one, just the same. So I want to do something different. But SPF, now I will say something very controversial.
Why?
Sunscreen, it is an illusion. And it is a dangerous illusion. Sunscreen, it's a last layer of the sun protection. People should not see sunscreen as an only sun protection.
Exactly.
It doesn't
work. I think that's the problem, because they apply SPF and they think they're protected, and they don't forget about other methods like wearing a hat or staying in the shade.
Yeah, just some lifestyle habits. And also you should understand, if your circadian rhythms are disturbed, your skin can be much more vulnerable to the ultraviolet during the day, because with a good circadian rhythms, we have natural circadian sun protection from 11 until 3 p.m. If you didn't sleep well, if you have circadian troubles, this sun protection can be moved to the evening or to the morning time. Antioxidant food. If you don't have enough of antioxidants circulating in your body,
like vitamin C.
Absolutely. Vitamin C and many of them, flavonoids, anthocyanins. Actually, it's easy to replace with the food, because see color, eat color. Everything colorful, it is full of antioxidants, because plants' pigments, they are powerful antioxidants. And if you don't have enough of antioxidants, if you have bad oxidative profile, it aggravates the harm of your skin.
And also, of course, other conditions like pregnancy, or some people are on medications that could trigger your skin to produce more melanin. However, I noticed in your advice that when you apply SPF, you mentioned you need to have a good portion of it. It's like 5-7 ml. So if you imagine for your face, you need to apply a teaspoon of SPF. It has to be a good amount, and you need to reapply it every 2 hours, really, so it works.
Yeah, yes and no, because it is rule created once again in 90s. Now, fortunately, we have new level of sunscreens in the recent years. We have more efficient filters and formulations. Now they are smarter. So 5-7 milliliters now, it's not mandatory for new sunscreens.
Great news.
Great, because no one did it.
No, I
Honestly,
it's so uncomfortable. It's so uncomfortable, and skin is so super shiny. You don't want to shine that much. You like radiance.
You want to look ugly.
You don't want to look ugly, exactly. I think it's good when you're on holiday and everyone is with these white faces and under the burning sun. But actually, if you're in town, just traveling from home to work, you don't want to be looking weird.
I always say that you need 3 sunscreens, and best choice if they're prescribed by you aesthetic doctors, dermatologists. So the first sunscreen, it is your 9 to 5 sunscreen, working days. Because if you are like me, or probably you don't
In
spend
London.
London, you go to your office in the morning and you're coming back in the evening.
Yeah.
So probably 20 minutes on the sun, it's best you can have. But makeup, great foundation with 30-35 plus sunscreen level will work, and you will look great. And it is important. At the weekend time, when you spend more time outdoors, it can be different. So it can be more powerful sunscreen, like 50 plus. But I also suggest to use tinted formula, for women at least. Because first of all, it's easy to see how you apply it.
True.
When it is tinted, it is controllable. And also it looks nicer.
Yeah.
It really unifies the skin color, and only on holiday.
Sometimes if you even have a good skin quality, it's like makeup. It gives you a little bit of a color, and it looks very good and natural.
Yeah.
Talking about ingredients, going back to ingredients, do you have any overhyped ingredients, that you heard of? And having you here as an expert and spending decades for developing skincare, you probably know what works and actually doesn't work. So any overhyped ingredients that you can name?
Some hypes, sometimes hype is born like a star is born. And for example, bakuchiol. It is amazing ingredient. It's retinol-like. It helps the aging skin to age more gracefully. And it is very similar mechanism. But God only knows why bakuchiol had this hype, and dozen of ingredients with the same action did it.
Maybe it was, because the retinols are giving side effects. I think when it only appeared, it was something like an alternative to a retinol. That's why people got to know it so much.
Yeah. And bakuchiol is great, but there are also a lot of ingredients which are similar to bakuchiol, but everyone knows bakuchiol. And no one is speaking about like Matrixil 3000.
Yes, true. Maybe the name is longer.
Yeah, maybe the name is longer. It's not on the nose. Another Exosomes now.
Oh,
absolutely hyped.
I completely agree. Even with injectables, it's something that are all over the place. And in the UK, it's allowed only to microneedle them, and you don't really inject them. But in Asia, for let's say last 5 years, they've been injected. But there's so much hype. Exosomes are everywhere. What do you think about them?
I think they are very dangerous because exosomes are responsible for horizontal DNA transfer. So it is a genetic transfer from another biological organisms to yours organisms. And we don't know how it works. We don't know.
We don't know. They are not allowed.
They're banned in China.
If in China something is banned, it must be really bad or dangerous. I mean, not bad. That I recently have been on the conference at Royal Society of Medicine, and there was this one of the doctors, actually, she was present there. Her case was discussed. She was injected with the human-derived exosomes, not in this country, it was in Dubai. And from the beautiful face, she got completely scarred face. Some kind of autoimmune process was triggered, and she developed scleroderma.
We don't know how it works. That's a problem. Also, it can transfer prions infections, creates Jacobs. And
Yes.
it can be extremely dangerous. It can manifest in dozens of hairs. And viruses, exosomes, they are responsible for viruses transfer. And when I hear people speaking about young women who've been their blood was well researched, come on. You are speaking about exosomes from placenta, and they are vulnerable young women who donate their placenta for these purposes because it just works like this.
Let's wait and see in 2 years.
I always say there will be some brave people who will experiment with themselves and we can observe.
Yes. I like the position of the UK in this instance. They wait, they look, they observe, and then they allow if it's really safe.
It is wise. Yeah.
If skincare can do all these things, why injectables needed at all?
That's a great question because skincare is not almighty. You know, for me, I imagine the skin needs as a pyramid, like Maslow pyramid. When in the very foundation, you have safety, you have the food access, and on the very top, you have spiritual growth. You cannot grow spiritually if you are hungry and just running from the tiger. And so it's the same for me in my mind. It's a pyramid Maslow for the skin. When in the foundation, it is not even the skincare. It is a sleep lifestyle, the healthy diet and healthy food, physical activity. And in the middle, it would be the skincare because skincare can help rebalance the microbiome to restore and maintain barrier function of the skin, to improve the antioxidant protection of the skin and do many ways, and also to interact with the skin targeting some cell function.
I would completely agree with you on this role distribution in the pyramid because I agree that injectables are on the top. Because of the amount of the injectables we deliver to people, it's not everyone has injectables, but everyone have to look after the skin and use at least some basic elements like moisturizers, like SPF. But when we're talking about injectables, I think injectables, it's about the volume, contour, and skin health. Whereas skincare, I think it's about texture and skin health. So where skin is a 3D organ, and we are looking at it from different angles. And of course, injectables, they can't treat the skin with a problem like rosacea, acne, but also they can't really cover that surface. And some of my patients, let's say most of them, they use good skincare, but some of them don't use skincare at all. They even barely moisturize the face. And after procedures, sometimes if they had a skin pill, their skin looks worse. And they ask me, Dr. Anna, I had these treatments, but today I can see more small wrinkles on the skin. And I'm asking her, did you use any creams at all? No, I didn't.
They've been not educated properly because, it is a big mistake of the education because skin needs help, unfortunately. Skin, probably human body is not really born to live in the modern cities. Probably we are not evolved enough to live in the city like London under the stress. So
there's lots of pollutants.
Probably before 25, before 27, your skin is a fighter, like your body is a fighter. But later, you need help. And people think that skincare, it's just a luxury. It is not a luxury, it is an essential.
Yes,
it is more hygiene.
Well, especially when I don't have enough time.
And for example, in dental practice, God bless, no one has these illusions and you can whiten your teeth once a year. Without using toothpaste.
Exactly. That's a very good comparison.
Yeah, it just toothbrushing and toothpaste, it's less expensive than skincare. That's how it works. But you need skincare, even the simple one. Good cleanser, good moisturizer, sunscreen. It is a minimum for the skin 30+.
It's like your three things that you can buy and have. That will be cleanser, moisturizer, and a skin.
My favorite 3 steps routine will be the gentle microbiome respecting cleanser, antioxidant moisturizing serum, because antioxidants, it's much easier to incorporate them in the water-based solution line, and moisturizer or sunscreen, or both of them. So still simple, still minimalist, still not 9 steps.
Not like Korean cosmetics. We were discussing with Tina before the podcast. We were talking about Korean steps and skincare. It's multi-componental, and not everyone has time for that. I would say busy women, working women, they just simply don't have time.
Yeah, me, I don't have time.
No.
I have 1 minute in the morning, 1 minute in the evening, and maybe 20 minutes once a week.
I'd say yet your skin looks amazing.
Oh, thank you so much. Actually, I'm a living experiment, because when I launched my brand in 2009, everyone told me, not everyone, but a lot of people and a lot of my colleagues told me, then let's see what you will think when you will be older, because I was like 37. Probably now I'm 54. And I thought, okay, I will experiment. I will not inject myself. I will not do laser or anything. I will see how your skin can live with the skincare. But regular skincare, just micro efforts every day. Skin is an organ which is able to be grateful. It takes years.
Yeah,
but we'll see it one day. And but I'm not saying to everyone that you don't need injectables, because I'm experimenting on myself. And when clients ask me,
experiment.
It's just, I think it's only fair, because as a topical skincare developer, I think it would be not fair.
I agree.
It's my responsibility to see how things works. But let's talk about injectables, because I'm not an expert in injectables. As I say, I never did it to myself, and I never performed to practice injectables in my life. I'm focusing on the topical. But it is very interesting topic, and now it's evolving so much. So tell us more.
Yeah, exactly. The injectables started to appear at the end of in 1990s, 2000s, when they just appeared on the market and developed to the degree and extent that most of people, at least once in life, they tried something. And it looks like now, in some psychology of people, that it's like going and doing their nails or a haircut. Talking about injectables, I think what is interesting to talk about is about the evidence. What is truly working? Where's the evidence? Is it marketing? As well as yourself, you mentioned there is a lot of marketing in the cosmetic industry. I'd say there is a lot of marketing in the aesthetic industry.
Even more, maybe.
I think even more. I agree. And surprisingly, popular procedures like vitamin injections or amino acid injections alone don't really have strong evidence base behind them. If we talk about hyaluronic acid and injections with hyaluronic acid, there is more evidence. There are randomized controlled studies on large groups of people showing the improved hydration, improved radiance, and in some cases elasticity. However, there are no kind of long-term studies suggesting that they actually reverse aging. They act for some period of time, and you need to do them repeatedly for them to work. There is more evidence around Botox. The more studies product probably, and is used in medicine to treat medical conditions like chronic migraines, muscle spasticity. And again, the effect is predictable, but short-lasting, temporary. There is more evidence about collagen stimulators like polyl-lactic acid or calcium hydroxyapatite. There are studies that proved, histological studies, randomized control studies that prove that collagen is getting produced more. However, we don't really have long-term data to say that it's actually modifying the aging process. And when the substance is in the skin, your skin responds and produces collagen. But whether it works when it's not in the skin, that's a question.
How you can have long-term data if the whole story started.
In probably 100
ago.
years we will.
Yeah, probably 100 years we will. And what I find really surprising that very often in the press, media, even on TV or movies, they're speaking so basically about injectables. Oh, she had Botox, when they see lips augmentations. So I think, first of all, people probably should understand better what you have in your tool bucket. So what you have as a doctor.
I think man would normally call Botox for everything. Lips, Botox. Forehead, Botox. Breast, Botox.
Botox.
Everything is Botox.
It's like a name.
Exactly. I think the simplicity is because people like the information to be delivered in a simple way. Another way to talk why it's so simplified, as I say, many people take it as a nail procedure or a hair procedure, and they are satisfied with the minimal information they have.
They should understand that it is a medical procedure that should be done by a doctor.
Absolutely.
Who has a proper education, who has a real medical trainings. Because, oh my God, I'm sorry to say it, but there's still a lot of people who are looking for better price and going for people who have no certificates, no education at all. They're buying this injectables product online.
Yeah.
And it is very dangerous. So how to recognize a good practitioner like you?
Thank you. I think when you mentioned the price, there are three main components in the price for the aesthetic procedure. First is the price of the product. Not all hyaluronic acid is the same. Hyaluronic acid molecule is a commodity molecule. The expensive part is how to make it a predictable gel from this molecule. Secondly, technology and production of the gel itself. Companies invest money in cross-linking technology. Hyaluronic acid doesn't stay in the skin for long. Native molecule stays in the skin for a few days. To make it last longer, companies invest and they chemically modify the gel to make it last longer. They invest to understand what are the sizes of the molecule, cohesivity, density. This all has to be regulated, and also advanced cleaning technologies are used to get rid of toxins and elements that shouldn't be in the gel. Because if you have something extra that shouldn't be there, your skin will respond with inflammation, or there is a risk of nodule formation. So that's one part of the story. There's the other part of the story, who is injecting?
And it is a big part of the story as well.
Yes, because I would say the cheaper product with the right rheological structure placed in the right level will outperform the expensive product placed wrongly, placed badly. Hence, I think the biggest kind of difference in the price is the abilities of the injector. I would say you will be safer if you go to a registered medical practitioner rather than a beauty salon where they do nails and the nail practitioner or hairdresser does it for you, because believe me, they do.
I would probably say then if it's someone who is offering great discounts, for me it's a red flag.
Yeah, because good products, they can't be cheap. If we talk about Botox, I recently was approached on WhatsApp by a Korean company or Chinese company, I don't know, and they were sending me like a booklet with prices for botulinum toxin, like 20 pounds per bottle. If you compare with the registered products, it will be like 150 per bottle. So the difference is huge. And you need to remember that Botox is a medical product, and the concentration of this toxin is very important. If it's a lot of the toxin in the bottle, it can have side effects, detrimental to health.
For me, it's so frightening, actually, because the botulinum toxin, it is a biological weapon.
Yeah.
And just before the launch of aesthetic procedures based on the botulinum toxin, it was very well protected in the military side mostly, because it's the most toxic substance.
A drop could paralyze the nerves. Yeah. Not to tell scary stories, but in the press, in the British press, there were some side effects described by patients injected with the unregulated product, ending up having problem swallowing.
The biggest problem, as I understand, then botulinum toxin can diffuse, can be systemically absorbed, and can affect the respiratory function. And it can be very harmful.
I think the official regulations are, it is advised not to inject more than 500 units at the same time. So it depends on the amount of the product you're injecting. It depends on the place where you're injecting. If you're injecting in the neck and you go deep, person could have difficulty swallowing. But I would say it is quite a studied project, and even in pregnancy, NHS would use botulinum toxin injections for pregnant women who have terrible migraines and medications are contraindicated. In this case, we use it. Why not?
Yeah, it's used in pediatry, used in ophthalmology, it's used for Parkinson's treatment. It is a great treatment, but in aesthetic, I think you can be safe when you are in a good hand. Practitioners like Dr. Anna, and who's using good quality products with full understanding.
And I think with experience of 10 years, believe me, the more I inject, the more I'm careful.
Yeah, I always say the bravest doctors are young doctors.
Yeah, exactly.
So how do you decide what kind of injectables someone needs?
Practically, I assess what is the problem, what is the need. Dynamic lines, they are normally muscle-driven, so botulinum toxin could help. If it's a volume loss, contour changes, then filler or collagen stimulator. If it's a skin quality concern, like fine lines and laxity of the skin, then we can use skin boosters, energy-based devices. But then, of course, we are assessing the anatomy, the aging morphotype of the patient, then proportions are very important, and safety profiles, autoimmune conditions, whether they had any treatments before, side effects. And it's important to assess the expectations of the patient, because sometimes expectations are unrealistic.
And unfortunately, it's quite often because some people, they're thinking that you're a fairy godmother. Yeah, with Almighty can do everything. And also, I think that some ethic problem and limitation sometimes. And remember, in my French clinic, once I've had a patient who asked me how to get round eyes because her husband loves owls.
Oh my God, I can believe.
Yeah, so, and I suppose in your practice, sometimes you meet patients who are asking for something which you don't think can be helpful, beneficial for patients.
Yeah, patient selection is very important. And it's our duty as doctors to see whether the patient's coming with the right reason for treatment. And sometimes they know if they're seeking for something that not helpful for them and can't be achieved.
I think in France they have good practice, especially plastic surgeon. They are obliged to sign if they suppose it is psychological problem,
like body dysmorphia.
Yeah. And they cannot perform any plastic surgery before than 2 weeks after the first consultation.
Yeah, it's called cooling period.
Yeah.
When the patient wants something, it's better for them to think about this, and if they're sure, then they would do.
Obviously, it is not when we are speaking about, when it is something which can be dramatically changing, can be or easily reversed.
Easily reversed, agree.
So better to get cooling period. That's great. But let's say I have 2 questions. First of all, if it is one injectable treatment which can be good for almost everyone.
Like with skincare, a moisturizer, cleanser, and SPF would be good for most of the patient, almost everyone. With the skincare injectables, I would say mostly for everyone, it would be good to have a skin booster with hyaluronic acid and some amino acids, because they do improve hydration, radiance, and it would be nice to have this effect.
Especially for probably some urban dwellers in the category 40 plus.
Yeah, and if they're using all the skincare and the skincare is good already, then we can, and they still have a problem, then a bit of injectable will deliver the product deeper and boost the skin, yeah.
And what is an injectable which is most overrated? In your opinion?
I would say probably the concept of non-surgical facelift is overrated rather than injectable alone. The concept, because in many clinics you could see a non-surgical facelift and we don't really know what it means. Often it would mean an energy-based device that would deliver some energy to the kind of lower face to lift it up. And it is a misconcept because the sagging of the skin when the patient is having a change in the contour, there are multiple reasons for that. And it starts from the volume loss, changes in the ligaments, laxity of ligaments, fat redistribution, muscle overactivity. All of these components, they overall affect the way the person looks. And only one single base device can't sort it out. Best thing is the combination approach, a bit of the botulinum toxin to relax the muscle, restore the volume where you're lacking it, and improve the skin quality.
Some smart,
yeah. Not one-off. And this is a misconception because these energy-based devices are so expensive, and they can, on the high street, a procedure could cost £1,500 per procedure. You need 3 of them. And people are really expecting to have a facelift without complications.
Also, they've been promised the facelift, literally.
Yeah.
So that's understandable why the expectations can be wrong.
I never promise anything that I can't achieve. And I think that's the reason of my success, because people trust me, and I would rather say that you might have an improvement, but you would not be like that person in the picture. You have a different anatomy, you have different lips.
That's why I love you practice so much, because you promise less, but you deliver more.
I think that's the gold key to success.
Yeah, absolutely. And another question, there are a lot of people who are afraid that injectables can be addictive. And we see examples sometimes, in the photo, and some celebrities who literally say, oh my God, I couldn't stop. Is it true?
I wouldn't call that injectables are addictive in the medical way, because addiction means withdrawals, cravings. We don't see it with Botox and fillers. However, people, they are used to look nice and well treated. And when the products are weaning off, they can see their natural aging. That's why they have maybe this sensation that actually they're aged more, or there is something wrong. And we aim not to create addiction, as should enhance your own features that you have, and you shouldn't feel that you can't live without this.
And I think aesthetic should make people feel better about themselves.
Exactly, not to change.
Yeah.
Not to make it noticeable. That's a misconception. Big misconception in aesthetics. There are 2, positive and negative. Positive is when people think that they can achieve everything. There is no long-term data that injectables can rejuvenate aging process. And negative misconception is Botox will make me look frozen, or everyone would see. You can't see it on my face. You can't see it on my patients' faces. It all looks natural.
It's everything. It's about the balance.
Yeah.
And about some common sense.
Yeah.
I will say. And I think that then we have now new generation of aesthetic doctors like yourself, because you are free of all this euphoria of the first years.
Yeah, I agree. The more experience you have, the more kind of you're expectant towards the new technologies that are coming, and you want to be conservative.
Yeah.
I think there is a last maybe question that we can discuss with you, because some patients in my clinic, they say, oh, doctor, for my skincare, I can dedicate £100 a month. Thinking now and having discussed that skincare is super important, and you can't replace skincare with injectables. And injectables is something that is on the top of the pyramid, and it's nice to have sometimes in some cases. What would you say? Let's say we have between us to share £100 per month. What do you think you could introduce?
I think you should be strategic, because obviously you can spend a lot of money for skincare and injectables. It's not a secret. But if you are strategic, if you understand what you need and how often you need something, it is easier to create some scheduled payment as well. For skincare, I will say the first rule, go for professional skincare. I explain why. Because it has the proof already, because beauticians, aesthetic doctors, clinics, they will not work with non-efficient skincare, because you will not be back if it didn't work.
Yeah.
And retail doesn't care about it so much, because people are still back. But in professional, it will be efficient, And if it is well chosen by practitioner, good quality practitioner, it will work on your skin. So I will say, let's go for the budget gentle cleanser, which is not stripping your precious microbiome, your precious lipids, and antioxidant protection, and good sunscreen, which you will, better sunscreen, the one you are comfortable to use.
Yes.
And also you can create the budget to get some injectables help if needed.
Yeah.
A few times a year.
Yeah.
So I can go with.
I would say, of course, I can't point it out exactly, but if I need to name only one, I would say probably botulinum toxin, because it's proven, it's effective, it relaxes and acts on the course of dynamic lines. And it's something that you can budget. In fact, from my practice, I see that patients who, let's say, can't afford many treatments, they would come twice a year for Botox, and good skincare, it will be their like optimum.
Also, you can combine with a good quality skincare, because look, we have this MyFix peptides-based concentrate, which can prolong results of the Botox. It costs about £85.
Yeah.
And it will be good for the whole year.
Because Botox, as we know, it stays in the tissues for 3 months, and then the molecule is simply not there. Some people see a clinical effect up to 6 months because their muscles are slowly kind of waking up. And in that period, when your injectable has wind off, you can use the peptides and prolong the effect and the smoothness of the skin.
Neuromuscular peptides will keep your superficial layer of muscles very relaxed for 6 months longer, and it's not very budgety thing.
And I think there are some areas where we can't really inject because of this possible penetration and distribution of the products. In the corners of the eyes, we have lots of small wrinkles. Please, you can use neuropeptides, which are now so effective and can mimic the injectable.
They don't replace each other.
Yeah,
they're very
I think they collaborate.
Kind of collaborate, kind of partnership, and also the good skincare. It can be not so expensive. In Meder, I will say, if people ask me what I should have with a limited budget, I always say cleanser.
Yes.
Because a good cleanser will improve the efficiency of all types of skincare which you're using after this cleanser, and bad cleanser will kill everything. So spend money for cleanser.
Great. So here we are. We have our routine. We discussed very intriguing, provocative questions today. And I'm so delighted to have this chat with you. And I hope we'll have a next episode in a couple of months.
Because we absolutely didn't speak about so many things we should speak in the future, but right now we came to the conclusion. So anesthetic doctors and beauticians, skincare and injectables, they are not replacing each other. It is a collaboration. So you can have both if you think strategically. Thank you so much for this discussion.
Thank you.
And great to see you soon. Thank you for joining us today on the Meder Beauty podcast. If you found this helpful, be sure to subscribe so you never miss an expert skincare tip. Have a question or topic you'd like for me to cover? Send me a message at podcast@mederbeauty.com and let's keep the conversation going. Also, you can visit mederbeauty.com and discover Meder Skincare, which I created. And if you enjoyed the show, I'd love if you left a review. It helps others find the podcast and keeps us growing. Until next time, stay healthy, stay glowing, and take care of your skin.